What are the criteria for assessing fitness to practice, and how do they differentiate between competency, conduct, and health issues? Answer. Fitness to practice is evaluated based on three primary criteria: competency, conduct, and health. Competency refers to the professional's ability to perform their duties effectively. Assessing competency involves reviewing the individual's education, training, and practical experience. This includes evaluating skills, knowledge, and the ability to apply them in real-world scenarios. For instance, competency assessments may involve direct observation of practice or reviewing case studies to ensure that practitioners maintain the necessary standards. Conduct. This pertains to the professional behavior of the individual. Conduct issues might arise from unethical behavior, professional misconduct, or violations of regulatory standards. For example, a practitioner may face an investigation if there are allegations of dishonesty or failing to follow ethical guidelines. The HCPC Code of Conduct outlines expected behaviors, including respecting confidentiality and maintaining integrity. Health. Health concerns can affect an individual's ability to practice safely and effectively. These may include physical or mental health issues that impair professional performance. The assessment may involve obtaining medical reports and ensuring the practitioner has access to appropriate support or treatment. Relevant guidelines. The HCPC provides guidance on fitness to practice, emphasizing the importance of ongoing professional development and the duty to report any health concerns that may impact practice. Each criterion must be weighed to balance public safety with professional autonomy, ensuring that practitioners are supported rather than unduly penalized. What types of allegations can arise against health and care professionals? What are the detailed procedures for handling these allegations? Answer. Allegations against health and care professionals can arise from various issues, including negligence, failing to provide the standard of care expected in their profession; misconduct, engaging in behavior that is unethical or unprofessional; criminal activity, being involved in illegal activities that undermine public trust; health concerns, issues related to the mental or physical health of the professional that may affect their practice. The procedures for handling these allegations typically involve several steps. Initial assessment. The HCPC conducts a preliminary assessment to determine if the allegation warrants further investigation. Gathering evidence. This involves collecting documents, witness statements, and other relevant information. Investigators must maintain confidentiality and fairness during this process. Inquiry panels. If the allegation is serious, the case may be referred to an inquiry panel which evaluates the evidence and determines whether the professional's fitness to practice is impaired. Discuss the ethical considerations involved in balancing public safety with the rights of professionals during fitness to practice evaluations. Answer. Balancing public safety with the rights of professionals is a complex ethical challenge in fitness to practice evaluations. Key considerations include public protection. The primary duty of regulatory bodies like the HCPC is to protect the public from potential harm. This involves ensuring that professionals meet the necessary standards and addressing any concerns regarding their fitness to practice swiftly and effectively. Due process. Professionals have the right to a fair evaluation process. This includes being informed of allegations against them, having the opportunity to respond, and access to a transparent appeals process. Ensuring due process protects the integrity of the evaluation and the rights of the practitioner. Confidentiality. Maintaining confidentiality throughout the evaluation process is crucial. It protects the reputation and privacy of the professional while also fostering an environment where individuals feel secure reporting concerns. Proportionality. Actions taken by regulatory bodies should be proportional to the severity of the alleged behavior. This means that sanctions should be appropriate to the level of risk posed to public safety and consider the circumstances surrounding each case. Mr. Thompson, a registered nurse, has received multiple complaints regarding his conduct, including allegations of inappropriate behavior towards patients. Upon investigation, it is revealed that Mr. Thompson has also been struggling with personal issues affecting his mental health. What factors should the HCPC consider when deciding on a sanction for Mr. Thompson, and what options might be available? Answer. In deciding on a sanction for Mr. Thompson, the HCPC should consider several factors. Nature and severity of allegations. The seriousness of the complaints against him is paramount. Inappropriate behavior towards patients is a serious concern that directly impacts public safety. Mental health considerations. The fact that Mr. Thompson is struggling with mental health issues should be taken into account. This may affect his behavior and could indicate the need for support rather than punitive measures. Previous conduct. Any prior complaints or disciplinary actions will also be relevant. A pattern of misconduct may warrant more severe sanctions. Public safety. The primary goal is to ensure that the public is protected. If Mr. Thompson poses an ongoing risk, immediate action may be necessary. Remediation potential. The HCPC should evaluate whether Mr. Thompson is likely to benefit from support and training to address his issues and improve his practice. Options available. Warning. A formal warning may be appropriate if the issues can be resolved through support. Suspension. Temporary suspension may be warranted if there is an immediate risk to public safety. Erasures. If the allegations are serious and there is a high risk of recurrence, the HCPC may decide to erase Mr. Thompson from the register. Relevant guidelines. The HCPC outlines a range of sanctions in its fitness to practice framework, emphasizing the need for proportionate responses and considering the individual's circumstances. Describe the techniques used for gathering and evaluating evidence during fitness to practice investigations and explain the importance of confidentiality. Answer. Evidence gathering in fitness to practice investigations involves various techniques. Document review. Collecting relevant documents such as medical records, practice logs, and previous complaint records is essential. This helps establish a factual basis for the investigation. Witness statements. Interviewing colleagues, patients, and other relevant parties can provide valuable insights into the practitioner's conduct and competency. Statements must be taken in a neutral manner to avoid bias. Expert opinions. In some cases, consulting with subject matter experts can help assess the professional's actions against established standards and best practices. Direct observation. If appropriate, observing the practitioner in their work environment may be necessary to assess their competencies firsthand. Importance of confidentiality. Maintaining confidentiality is crucial during investigations to protect the integrity of the process, ensure the privacy of all parties involved, and encourage individuals to come forward with information without fear of repercussion. Breaches of confidentiality can lead to reputational damage and deter future reporting of concerns. Explain the steps involved in the appeals process following a fitness to practice decision and the rights and responsibilities of the involved parties. Answer. The appeals process following a fitness to practice decision typically involves several critical steps. Notification of decision. The professional must be formally notified of the decision made by the inquiry panel, including the reasons for the decision. Submission of appeal. The professional has the right to submit an appeal against the decision within a specified time frame. This appeal must outline the grounds for the appeal, such as procedural errors or new evidence. Review by the appeal panel. An independent appeal panel will review the case, examining the original evidence and the appeal submission. They may consider written submissions or hold a hearing where both parties can present their cases. Decision on appeal. The appeal panel will make a determination which can uphold, modify, or overturn the original decision. The outcome will be communicated to all parties involved. Rights and responsibilities. Rights. The professional has the right to be represented during the appeal, to present their case, and to receive a fair hearing. They should also be informed of their appeal outcomes in a timely manner. Responsibilities. The professional must adhere to the appeals timeline and provide relevant evidence to support their case. They are also responsible for maintaining confidentiality regarding the appeal process. Relevant guidelines. The HCPC's appeals process guidelines ensure fairness and transparency, emphasizing the importance of impartiality and due process for all parties involved. Analyze the ethical dilemmas that arise from the need to prioritize public protection over professional autonomy in fitness to practice evaluations. Answer. The tension between public protection and professional autonomy often leads to ethical dilemmas. Key points include public safety. Regulatory bodies prioritize the safety of the public, necessitating that actions be taken against professionals who pose a risk. This can conflict with the autonomy of professionals who may feel their rights are being infringed upon. Support versus punishment. When a professional is found to be unfit to practice, the regulatory body faces the dilemma of whether to impose sanctions or provide support for rehabilitation. The goal is to protect the public while also helping the practitioner regain their capacity to practice safely. Transparency versus confidentiality. Investigations must be conducted transparently to maintain public trust, yet confidentiality is crucial to protect the rights and reputations of professionals. Balancing these needs can create ethical conflicts. Professional rights. Professionals may feel that their autonomy is compromised when faced with investigations or sanctions, leading to concerns about fairness and justice. Provide an analysis of a case study where fitness to practice was called into question due to mental health issues, outlining the considerations taken during the evaluation process. Answer: in a notable case, a psychologist, Dr. Adams, faced allegations of impaired judgment linked to a diagnosed mental health condition. The following considerations were taken during the evaluation process. Assessment of fitness. An independent assessment was conducted to evaluate Dr. Adams' competency in light of her mental health diagnosis. This involved reviewing her clinical work, patient feedback, and psychological evaluations. Support and rehabilitation. Given the nature of her condition, the evaluation emphasized the need for support rather than outright punishment. Recommendations included a structured rehabilitation program focused on mental health management. Public safety versus support. The inquiry panel had to balance public safety with Dr. Adams' right to practice. They determined that with appropriate support and monitoring, she could return to practice safely after a defined period. Ongoing monitoring. The panel recommended regular reviews of Dr. Adams' mental health and professional practice to ensure continued fitness to practice. Discuss the various types of sanctions that can be imposed on health and care professionals found unfit to practice and the factors that influence sanction decisions. Answer: the HCPC outlines several sanctions that can be imposed on professionals deemed unfit to practice. Warnings. A formal warning may be issued for less severe infractions, serving as a reminder to adhere to professional standards. Conditions of practice. The professional may be allowed to continue practicing under specific conditions, such as regular supervision or mandatory training. Suspension. In cases where there is an immediate risk to public safety, suspension from practice may be warranted. This can be temporary, pending further investigation. Erasures. The most severe sanction involves removal from the professional register, prohibiting the individual from practicing. Factors influencing sanction decisions. Severity of conduct. The seriousness of the violation significantly affects the type of sanction imposed. Public safety. Considerations regarding the safety of the public are paramount. Remorse and insight. Demonstration of remorse and an understanding of the impact of one's actions can lead to lighter sanctions. Previous record. A history of prior complaints or disciplinary actions may result in harsher penalties. Relevant guidelines. HCPC's guidelines on sanctions provide a framework for ensuring that actions taken are proportionate and just, reflecting the principle of public protection while also considering the rights of the practitioner. How does the HCPC define competency in the context of fitness to practice, and what role does conduct play in this assessment? Answer: competency, as defined by the HCPC, refers to the ability of a health or care professional to perform their duties to the required standards of practice, which encompasses the following elements: knowledge and skills. Competency requires a sound understanding of relevant medical or care-related knowledge and the practical skills necessary to deliver care effectively. Professional judgment. The ability to make informed decisions in clinical situations is crucial. Competency is not merely about knowledge, it also involves applying that knowledge appropriately in practice. Continual professional development. The HCPC mandates that practitioners engage in ongoing education and training to maintain their competency levels. This includes staying updated with best practices and advancements in their field. Role of conduct. Conduct directly influences the assessment of competency. Unprofessional behavior, such as dishonesty or failure to adhere to ethical standards, can undermine a professional's competency evaluation. For example, if a practitioner demonstrates a lack of respect for patient confidentiality, it raises concerns about their overall professional judgment and integrity. Discuss the standards of proficiency established by the HCPC. How do these standards influence the clinical decision-making process for healthcare professionals? Answer: the standards of proficiency (SOP) set out by the HCPC serve as a benchmark for the knowledge, skills, and behaviors required for safe and effective practice in health and care professions. These standards influence clinical decision-making by providing a framework that ensures healthcare professionals assess the needs of patients. Professionals must be competent in gathering and interpreting patient information to make informed decisions about care. Deliver evidence-based care. The SOP emphasizes the importance of utilizing current evidence and guidelines to inform clinical judgments and interventions. Reflect on practice. Healthcare professionals are required to engage in reflective practice to continuously improve their skills and maintain high standards of care. Maintain professionalism. The standards mandate that practitioners adhere to ethical guidelines, ensuring that their decisions prioritize patient safety and well-being. The application of the SOP promotes a culture of accountability and professionalism, ultimately leading to improved patient outcomes and enhanced trust in the healthcare system. Describe the importance of continuing professional development (CPD) for healthcare practitioners. What strategies can professionals employ to effectively document and reflect on their CPD activities? Answer: continuing professional development (CPD) is crucial for healthcare practitioners as it ensures that they remain competent in their roles, stay updated with the latest advancements in their fields, and continuously enhance their skills and knowledge. Effective strategies for documenting and reflecting on CPD activities include keeping a CPD portfolio. Practitioners should maintain a detailed record of their CPD activities, including formal training, workshops, and informal learning experiences. This portfolio should reflect learning outcomes, skills gained, and how the activities relate to their professional practice. Reflective practice. Engaging in regular reflective practice allows practitioners to critically evaluate their experiences. Utilizing models such as Gibbs' reflective cycle can help structure this reflection, leading to deeper insights and actionable learning. Setting personal development goals. Professionals should identify specific competencies they wish to improve and create a plan to achieve these goals through targeted CPD activities. Seeking feedback. Actively soliciting feedback from peers and supervisors can provide valuable insights into areas for improvement and affirm successful practices. Telehealth is becoming an integral part of healthcare delivery. Identify and analyze the ethical considerations that healthcare professionals must navigate when utilizing telehealth services. Answer: the integration of telehealth into healthcare delivery raises several ethical considerations, including informed consent. Professionals must ensure that patients understand the telehealth process, including potential risks, benefits, and alternatives. Patients should give informed consent without coercion, understanding their rights regarding privacy and data security. Confidentiality and data security. Maintaining patient confidentiality is paramount. Healthcare providers must utilize secure platforms for telehealth consultations to protect sensitive patient information. This includes understanding legal obligations under the General Data Protection Regulation (GDPR) and ensuring compliance with relevant data protection laws. Equity of access. Ethical practice demands that telehealth services are accessible to all patients, regardless of socioeconomic status, geographic location, or technology literacy. Practitioners should advocate for solutions that bridge the digital divide and ensure equitable access to care. Quality of care. Providers must ensure that the standard of care delivered via telehealth is equivalent to in-person visits. This includes being adequately trained in telehealth technologies and adapting clinical practices to the virtual environment. Professional boundaries. Telehealth can blur the lines between personal and professional life. Healthcare professionals should establish clear boundaries to maintain professionalism and ensure that patient relationships remain ethical and focused on care. By addressing these ethical considerations, healthcare professionals can ensure that their use of telehealth aligns with the principles of patient-centered care and professional integrity. Evaluate how emerging technologies have transformed patient care in the healthcare sector. What challenges do healthcare professionals face when integrating these technologies into their practice? Answer: emerging technologies have significantly transformed patient care by enhancing diagnosis and treatment. Technologies such as AI and machine learning facilitate advanced diagnostic tools that improve the accuracy of diagnoses and personalized treatment plans, improving patient engagement. Digital health solutions, such as mobile health apps and patient portals, empower patients to engage actively in their care by providing easy access to health information and communication with healthcare providers. Facilitating remote monitoring. Wearable devices enable continuous health monitoring, allowing for proactive management of chronic conditions and timely interventions. Streamlining administrative processes. Electronic health records enhance efficiency by improving documentation, reducing errors, and facilitating better coordination among healthcare teams. However, healthcare professionals face several challenges when integrating these technologies. Training and adaptation. Continuous training is required to keep staff updated on new technologies and their applications. Resistance to change can hinder the effective adoption of technological solutions. Data privacy concerns. As patient data becomes increasingly digitized, professionals must navigate legal frameworks and ethical guidelines to protect patient information from breaches. Cost implications. Implementing new technologies can be costly, leading to budget constraints that may impact resource allocation and patient access to care. Quality of care. Balancing technology use with the need for human interaction in patient care is essential. Over-reliance on technology can detract from the empathetic, personalized care patients need. By addressing these challenges, healthcare professionals can maximize the benefits of emerging technologies while ensuring patient-centered care. Mr. Thompson, a 45-year-old patient with a history of diabetes, is struggling to manage his blood sugar levels effectively. He has expressed concerns about using a continuous glucose monitor, CGM, due to potential data privacy issues and the reliability of the device. As his healthcare provider, what steps should you take to address Mr. Thompson's concerns and facilitate his use of the CGM? Answer: as Mr. Thompson's healthcare provider, it is crucial to approach his concerns with empathy and provide comprehensive information to facilitate his decision-making regarding the continuous glucose monitor, CGM. The following steps should be taken: educate on the technology, provide clear, detailed information about how the CGM works, its benefits for managing diabetes, and how it can improve his quality of life. Emphasize the importance of accurate blood sugar monitoring in preventing complications associated with diabetes. Address data privacy concerns. Explain the measures taken to safeguard patient data collected through the CGM. Discuss relevant regulations, such as the GDPR, that protect patient information and clarify how his data will be used, stored, and shared. Offer support. Encourage Mr. Thompson to voice his concerns and questions about the device. Offer to arrange a demonstration or provide access to resources such as patient testimonials or educational videos that highlight the CGM's effectiveness and safety. Collaborate on a management plan. Involve Mr. Thompson in developing a comprehensive diabetes management plan that includes the CGM as a tool. Discuss potential barriers to adherence and collaborate on solutions that meet his lifestyle needs. Follow up. Schedule regular follow-ups to assess his experience with the CGM and make adjustments as necessary. Continuous support can help alleviate concerns and foster a sense of trust in the technology. By addressing Mr. Thompson's concerns through education, empathy, and ongoing support, you can empower him to make informed decisions about his diabetes management. Analyze the role of professional behavior in maintaining trust in the patient-provider relationship. What actions can healthcare professionals take to ensure their behavior aligns with the standards set by the HCPC? Answer: professional behavior is vital in maintaining trust within the patient-provider relationship as it directly influences patient perceptions of care quality and safety. The HCPC standards emphasize the importance of integrity, honesty, and professionalism. Healthcare professionals can take the following actions to ensure their behavior aligns with these standards. Adhere to ethical guidelines. Professionals must familiarize themselves with ethical guidelines and codes of conduct relevant to their profession. Upholding these standards demonstrates a commitment to ethical practice and accountability. Effective communication. Engaging in clear, respectful communication fosters transparency and encourages patients to share their concerns. Practitioners should actively listen to patients and address their questions, building rapport and trust. Demonstrate empathy and compassion. Showing empathy toward patients enhances their experience and reassures them of the provider's commitment to their well-being. This behavior aligns with the HCPC's emphasis on person-centered care. Practice cultural competence. Understanding and respecting diverse cultural backgrounds can improve interactions with patients and reduce misunderstandings. Professionals should engage in training on cultural competence to enhance their ability to provide inclusive care. Continuous self-reflection. Engaging in regular self-reflection allows practitioners to evaluate their behavior and identify areas for improvement. This process helps maintain professional standards and enhances self-awareness. By actively promoting professional behavior aligned with HCPC standards, healthcare professionals can foster trust, enhance patient satisfaction, and ensure high-quality care. Provide a detailed analysis of a case where a healthcare professional successfully applied the standards of proficiency in a challenging clinical situation. What competencies were demonstrated and what was the outcome? Answer: consider the case of a physiotherapist, Sarah, who encountered a 70-year-old patient, Mr. Johnson, recovering from hip replacement surgery. The application of the HCPC standards of proficiency was crucial in ensuring positive patient outcomes. Clinical skills. Sarah utilized her clinical skills to conduct a comprehensive assessment of Mr. Johnson's mobility, pain levels, and overall functionality. This involved performing range of motion tests and identifying specific areas requiring intervention. Communication skills. Sarah effectively communicated with Mr. Johnson, explaining the rehabilitation process and addressing his fears about pain during exercises. She used clear, empathetic language, ensuring he understood the importance of following the prescribed exercises for recovery. Professional behavior. Throughout the sessions, Sarah maintained A professional demeanor. Respecting Mr. Johnson's privacy and dignity, she demonstrated patience and understanding, which helped build a trusting therapeutic relationship. Decision-making. Based on her assessment, Sarah tailored a rehabilitation program specific to Mr. Johnson's needs, incorporating gradual increases in activity and pain management techniques. Her decisions were evidence-based, following guidelines from professional organizations. Reflective practice. After each session, Sarah reflected on her approach and solicited feedback from Mr. Johnson to adapt future sessions. This iterative process exemplified her commitment to continuous improvement. Outcome. As a result of Sarah's proficient application of skills, Mr. Johnson experienced significant improvements in mobility and confidence, successfully achieving his rehabilitation goals. This case illustrates how adherence to the standards of proficiency leads to enhanced patient care and outcomes. Critically assess the advantages and challenges associated with implementing digital health solutions in healthcare practices. How can healthcare professionals effectively navigate these challenges? Answer. Digital health solutions offer several advantages, including enhanced accessibility. Digital health technologies facilitate access to healthcare services, particularly for patients in remote areas or those with mobility challenges. Telemedicine expands reach and reduces barriers to care. Improved patient engagement. Patients can actively engage in their health management through mobile health applications that track progress, send reminders, and facilitate communication with providers. Data collection and analysis. Digital solutions enable more efficient data collection, allowing healthcare professionals to analyze trends and make evidence-based decisions to improve patient outcomes. However, several challenges arise. Technology literacy. Some patients may struggle with using digital health solutions due to a lack of familiarity with technology. Professionals should assess patients' technology literacy and provide necessary support and training. Data security risks. The digitization of health information raises concerns regarding data breaches and privacy violations. Healthcare professionals must ensure compliance with data protection laws and utilize secure platforms. Integration with existing systems. Implementing digital solutions may face resistance from staff accustomed to traditional methods. Training and demonstrating the benefits of new technologies can aid integration. Navigating challenges. Education and training. Professionals should engage in continuous education to stay abreast of digital health developments and develop the skills to assist patients effectively. Stakeholder engagement. Involving all stakeholders, patients, staff, IT professionals in the implementation process ensures a collaborative approach and addresses concerns early on. Regular evaluation. Continuous evaluation of digital health solutions can help identify areas for improvement and ensure they meet patient and provider needs. Identify and discuss a current public health issue. What strategies can health professionals employ to address this challenge effectively? Answer. One pressing public health issue is the mental health crisis exacerbated by the COVID-19 pandemic. Many individuals experience increased anxiety, depression, and isolation due to prolonged lockdowns, job loss, and disruptions in daily routines. Strategies to address this public health challenge include community engagement. Health professionals should engage with communities to understand their unique challenges and needs related to mental health. Conducting surveys and focus groups can provide insights into community-specific concerns. Educational programs. Developing and implementing educational programs on mental health awareness can help reduce stigma and encourage individuals to seek help. Information should be tailored to the target audience to ensure effectiveness. Collaborative care models. Integrating mental health services into primary care settings allows for holistic patient management. Healthcare providers can screen for mental health issues during routine visits and provide referrals to mental health specialists. Teletherapy and online resources. Promoting teletherapy services can increase accessibility for individuals hesitant to seek in-person care. Additionally, providing online resources, such as self-help tools and hotlines, can support individuals in crisis. Policy advocacy. Health professionals can advocate for policies that promote mental health funding, resources for underserved populations, and initiatives aimed at reducing barriers to mental health services. By employing these strategies, health professionals can play a vital role in addressing the mental health crisis and promoting overall well-being in their communities. Analyze a successful public health intervention that addressed a significant health issue in a community. What factors contributed to its success, and how can these factors be replicated in future interventions? Answer. One successful public health intervention is the Smoke-Free England initiative, launched in 2007, which aimed to reduce smoking rates and improve public health. Key factors contributing to its success include comprehensive legislation. The introduction of legislation prohibiting smoking in public spaces created an environment that discouraged smoking and protected non-smokers from second-hand smoke exposure. Public awareness campaigns. Extensive media campaigns educated the public on the dangers of smoking and the benefits of quitting. These campaigns utilized various platforms, including television, radio, and social media, to reach a broad audience. The accessible support services. The initiative provided accessible smoking cessation programs, including counseling and pharmacotherapy. These services were widely promoted and integrated into healthcare settings. Community involvement. Engaging community stakeholders, such as local councils and health organizations, fostered collaboration and support for the initiative. Their involvement ensured that the program was tailored to meet local needs. Regular monitoring and evaluation. Continuous assessment of the initiative's impact allowed for adjustments and improvements over time, ensuring that the intervention remained effective and relevant. Replication. To replicate the success of this intervention in future public health initiatives, key strategies should include building strong coalitions among stakeholders to foster collaboration and support, implementing comprehensive educational campaigns that utilize multiple channels to reach diverse populations, providing accessible services tailored to community needs, ensuring inclusivity, establishing a framework for ongoing evaluation to monitor progress and adapt strategies as necessary. By applying these factors, future public health interventions can enhance their effectiveness and lead to meaningful improvements in community health outcomes. Discuss the significance of the Health and Care Professions Order 2001 in the establishment of the HCPC. What are its key provisions, and how do they shape the HCPC's regulatory role? Answer. The Health and Care Professions Order 2001 is a pivotal piece of legislation that established the HCPC, defining its scope, powers, and responsibilities. Key provisions of this order include registration of health and care professionals. The HCPC is tasked with maintaining a register of professionals eligible to practice in their respective fields. This ensures that only those who meet the required standards can provide care to the public. Standards of proficiency. The order mandates the establishment of standards for the training and practice of regulated professionals, ensuring they possess the necessary skills and knowledge. Fitness to practice. The HCPC has the authority to investigate concerns about professionals' fitness to practice, including cases of misconduct or incompetence. This provision is crucial in maintaining public safety and trust. Continuing professional development, CPD. The HCPC enforces the requirement for professionals to engage in ongoing education and development, ensuring they remain competent in their practice. Explain the governance structure of the HCPC. How does this structure ensure accountability and transparency in its operations? Answer. The governance structure of the HCPC is designed to promote accountability and transparency through various components. Council. The HCPC is governed by a council consisting of elected registrants and appointed lay members. This mixed representation helps balance professional insights with public interests. Committees. The Council delegates specific functions to committees, including the Fitness to Practice Committee, the Education Committee, and the Standards Committee. Each committee focuses on particular areas of regulation, ensuring specialized oversight. Public interest. Lay members of the Council and committees act as representatives of the public, ensuring that decisions reflect public concerns and maintain trust in the profession. Accountability mechanisms. The HCPC publishes annual reports and financial statements outlining its activities, financial performance, and strategic objectives. This promotes transparency in decision-making and resource allocation. Together, these elements create a robust governance framework that fosters public confidence in HCPC's regulatory role. Describe the key principles outlined in HCPC's standards of conduct, performance, and ethics. How do these principles guide health and care professionals in their practice? Answer. The HCPC standards of conduct, performance, and ethics provide a framework for professional behavior, emphasizing the following key principles. Integrity. Professionals must demonstrate honesty and uphold the values of their profession, ensuring trust from service users and colleagues. Respect for service users. Professionals are required to treat service users with dignity and respect, considering their diverse needs and preferences. Accountability. Health and care professionals must take responsibility for their actions and decisions, ensuring they practice safely and effectively. Professionalism. Practitioners are expected to maintain high standards of behavior, including punctuality, reliability, and continuous development of skills. Confidentiality. Upholding confidentiality is critical. Professionals must safeguard personal information obtained during the course of their practice. These principles guide professionals in making ethical decisions, promoting a culture of integrity and respect within health and care environments. Mr. Adams, a registered physiotherapist, has been approached by a patient who wishes to discuss a personal issue that does not relate to his treatment. The patient insists on discussing this matter, expressing that it is crucial for their well-being. How should Mr. Adams navigate this situation according to the HCPC standards of conduct, performance, and ethics? Answer: Mr. Adams should consider the following steps to navigate this situation while adhering to the HCPC standards of conduct, performance, and ethics. Assess relevance. He should first assess whether the personal issue has any direct impact on the patient's treatment. If it does not, he must communicate this clearly to the patient. Maintain boundaries. The HCPC guidelines emphasize the importance of professional boundaries. Mr. Adams should politely explain that while he values the patient's concerns, personal discussions that do not relate to treatment should be avoided. Referral to appropriate services. If the issue is significant for the patient's well-being, Mr. Adams can suggest that the patient seek support from relevant professionals, such as a counselor or psychologist, who can address personal matters. Documentation. He should document the interaction in the patient's records, noting the patient's request and his response to ensure transparency and accountability. By following these steps, Mr. Adams upholds professional standards while ensuring the patient receives appropriate support for their personal concerns. Discuss the importance of diversity and inclusion in health and care practice as outlined by the HCPC. What strategies can professionals implement to foster an inclusive environment for service users? Answer: diversity and inclusion are essential components of effective health and care practice. The HCPC emphasizes the following points regarding their importance: respect for individual differences. Recognizing and respecting the diverse backgrounds of service users, including race, gender, age, disability, and cultural beliefs, enhances the quality of care provided. Cultural competence. Professionals must develop cultural competence, enabling them to understand and address the specific needs of diverse populations. Improved outcomes. Inclusive practices lead to better health outcomes as they ensure that all service users feel valued and understood, which can enhance their engagement in their care. Strategies to foster inclusion. Training and development. Professionals should engage in regular training on diversity and inclusion to enhance their understanding of the unique needs of different populations. Policy implementation. Organizations should implement policies that promote diversity and inclusion, ensuring that all staff are aware of and committed to these values. Analyze a hypothetical case where a healthcare professional fails to maintain patient confidentiality, resulting in a breach of HCPC standards of conduct, performance, and ethics. What are the potential consequences for the professional, and what steps should be taken to address the breach? Answer: in a hypothetical case where a healthcare professional discloses a patient's confidential information without consent, the consequences could include fitness to practice investigation. The HCPC may initiate an investigation into the professional's conduct, assessing whether their actions compromise public safety and trust. Sanctions. If found in breach, the professional may face sanctions ranging from a caution to suspension or removal from the HCPC register, depending on the severity of the breach. Legal implications. The patient could pursue legal action for breach of confidentiality, resulting in potential civil liability for damages. Steps to address the breach. Immediate notification. The professional should notify their employer and relevant authorities immediately, allowing for a timely response. Assessment of impact. Assess the extent of the breach and its impact on the patient, including whether the information shared was sensitive and whether it could harm the patient. Implementation of corrective measures. The professional and the organization should implement corrective measures, such as additional training on confidentiality and data protection, support for the patient, offer support and reassurance to the affected patient, addressing their concerns and providing information on how their confidentiality will be safeguarded in the future. By taking these steps, the professional can demonstrate accountability and a commitment to rectifying the situation while maintaining the integrity of their practice. Explain how the HCPC interacts with other regulatory bodies in the integration of health and social care regulation. What benefits does this integration provide to service users? Answer: the HCPC collaborates with various regulatory bodies such as the Care Quality Commission (CQC) and other professional regulators to ensure cohesive regulation across health and social care services. Key aspects of this interaction include shared standards. By aligning regulatory standards, the HCPC and other bodies can provide a consistent approach to quality and safety across health and social care sectors. Information sharing. Collaborative efforts allow for information sharing regarding fitness to practice concerns, improving the ability to address issues promptly and effectively. Joint inspections. The HCPC participates in joint inspections with other regulatory bodies to assess services holistically, ensuring compliance with both health and social care regulations. Benefits to service users. Enhanced safety. Integrated regulation promotes higher safety standards, ensuring that service users receive care from professionals who meet comprehensive competency requirements. Improved access to services. Collaboration can lead to streamlined services, making it easier for service users to navigate the health and social care systems. Holistic care. By fostering communication among regulators, service users can receive more coordinated and holistic care, addressing their complex needs effectively. Through these collaborative efforts, the HCPC contributes to a more integrated and effective health and social care system. Discuss the significance of continuing professional development (CPD) for health and care professionals as outlined by the HCPC. What are the consequences of failing to engage in CPD? Answer: continuing professional development. CPD is crucial for health and care professionals for several reasons. Ensures competence. CPD helps professionals maintain and enhance their skills, ensuring they stay up to date with the latest practices and guidelines. Improves service quality. Engaging in CPD leads to improved service quality, as professionals who actively develop their knowledge are better equipped to meet the needs of service users. Adaptation to change. The healthcare landscape is continuously evolving. CPD enables professionals to adapt to new technologies, methodologies, and regulatory changes. Consequences of failing to engage in CPD. Fitness to practice issues. Failure to participate in CPD may result in the HCPC questioning a professional's fitness to practice, potentially leading to an investigation. Sanctions. Professionals may face sanctions, including removal from the register if they cannot demonstrate engagement in CPD and its relevance to their practice. Analyze the role of ethics in health and care professions as regulated by the HCPC. How do ethical considerations influence decision-making in complex cases? Answer: ethics play a fundamental role in guiding health and care professionals' conduct as outlined by the HCPC. Key aspects include framework for decision-making. Ethical guidelines provide a framework for professionals to navigate complex situations, helping them to balance competing interests and values. Patient-centered care. Ethics emphasize the importance of prioritizing patient welfare and autonomy, ensuring that service users' preferences and needs are central to decision-making. Accountability and integrity. Professionals are held accountable for their ethical decisions, fostering integrity and trust in the healthcare system. Influence of ethical considerations. Complex case analysis. In complex cases where ethical dilemmas arise, such as end-of-life decisions or consent issues, professionals must weigh the ethical implications of their choices carefully. Collaborative decision-making. Ethics often necessitate collaboration among multidisciplinary teams to ensure diverse perspectives are considered, promoting holistic approaches to care. Examine the historical context of the HCPC's establishment. How did its origins and key milestones shape its current regulatory role? Answer: the HCPC was established to address the need for effective regulation of health and care professions in the UK. Key milestones in its history include 1996, the introduction of the Health Professions Order, which laid the groundwork for the regulation of various healthcare professions. 2001, the formal establishment of the HCPC, which brought together several previously separate regulatory bodies under one umbrella, enhancing regulatory coherence. 2009, introduction of new standards for education and training, reflecting evolving practices and ensuring that professionals meet the competencies required in contemporary healthcare settings. Impact on current regulatory role. Unified regulation. The HCPC's formation allowed for a unified approach to regulation, enhancing public safety and trust by ensuring consistent standards across professions. Adapting to change. Historical developments have positioned the HCPC to adapt to changes in the healthcare landscape, allowing it to respond effectively to emerging challenges in service delivery.